My name is David Chen, and I am presenting results from a quality improvement project related to the implementation of a hospital violence intervention program in Delaware. Assault-related trauma, especially from firearm violence, carries high rates of re-injury, morbidity, and mortality, yet affected patients are often disconnected from health systems and care. Hospital-based violence intervention programs, or HVIPs, have emerged as an effective method for reducing injury rates, but program structure and implementation are variable. The key component of an HVIP is to engage patients who are injured by violence, typically in a hospitalized or emergency department setting, with intensive case management to help continue to meet needs following discharge. We describe early quality improvement outcomes and measures for patient engagement at an HVIP implemented with an intensive case management team at ChristianaCare Health System from February through September of 2021. Our implementation of this model revolved around engaging patients identified as eligible for the program with a community health worker and associated intensive case management team. We prioritized meeting patients at the bedside that required hospitalization and so therefore those with more severe injuries. We chose not to approach patients identified as victims of intimate partner violence so as to not overlap with a similar but separate program, or patients with severe brain injury and inability to answer questions. We attempted to contact patients that could not be engaged at the bedside, most commonly because they were discharged from the emergency department setting by telephone. Overall, we found a much higher rate of engagement and enrollment for those met at the bedside. This is in part because many patients discharged from the emergency department provided phone numbers that were not in service or whom did not return at least 3 attempted phone calls and voice messages. Nearly all patients who were enrolled completed a social determinant of health screening, which identified as the most common areas of concern interpersonal safety, financial instability, and healthcare access. These results are important as they help direct program focus to continue to prioritize bedside engagement and to better identify resources for patient assistance in mitigating disparities and inequities.